Hello, everyone. I know I'm going to be talking here, and there won't be anybody actually paying any attention at this very moment, but I have gone live. I'm actually not sure how this is going to go today. I really just want to start the conversation and see if I can get some input from you guys. I will definitely open up the chat to make sure that I can get some input from you guys. It's a bit difficult. I haven't used this particular platform, which is StreamYard, to navigate chats. As of now, I do have my YouTube open. I can see I'm live on YouTube, so I know everything's working, which is awesome. So anyway, welcome. Happy Friday. It is 12 p.m. I know I originally said I was going to start this at 1, but unfortunately, I have a schedule conflict with a couch delivery, and I did not want to be having a couch delivery guys show up while I was giving this seminar. So I'm going to do it. It's going to be recorded anyway. I do have a PowerPoint, and the PowerPoint's literally just there to give me some directions to where I want to go with this. I will entertain questions as best I possibly can. This chat is open, so hopefully I can see what's going on here. And as input comes in, so if someone who is watching, because I see there's a couple of you guys watching, if someone who's watching can just write something into the chat, whatever platform you're on, I want to see if it shows up on my platform on this side of things. So hopefully it does. If not, I can obviously view on Facebook, YouTube, etc. I'm currently looking at YouTube from my end. So anyway, if you can type something in the chat for me, that'd be amazing. I appreciate you guys being here. I know a lot of people are going to watch this after the fact. The purpose of this seminar, and I'm going to go to a screen share here, is just the slides are just to give you some direction, maybe give you some insights where you can get some additional information about some of the topics I'm going to cover. But most importantly, really what I want to get into is sort of like the key concept of what today is all about, is that technique matters. Stacking joint dynamic postural stability matters. Overcoming, biomechanical issues and what we call altered biomechanics are also important when it comes to movement-based training. So obviously movement for life, health, and fitness and performance are all sort of integrated into this one area. That it's about posture, it's about alignment and structure in the movement patterns, and obviously depending on degrees of freedom and vector variabilities will be impacted by the amount of load that we're putting on the movement pattern. So going to cover off a lot of different things. We're going to talk about breath integration. It's going to be a very practical session. Be like, well, how do I manage myself in a movement pattern? And if I'm what I like to refer to as the leader of one, right? The leader of one is the leader of many. If you can't lead one, you can't lead any. So learning how to manage yourself into these positions and postures is going to be incredibly important towards how you then pass that information on to your clients. So either way, I'm just going to take a run at this. We're going to do our very best to try and get some practically useful information from this. So right from the get-go, I'm just going to go into my screen share. I can't see anything showing up in the chat, which is unfortunate. So I'm going to have to deal with the questions after the fact. Application window. Been a while since I've been on this platform. It's a bit crazy. So I'm just going to go share. Excellent. Okay. So anyway, the point is the workout is your rehab. And really at the end of the day, the reason why for this, I mean, I don't want to take away from Charlie Weingroff, but Charlie has this called training is rehab or rehab is training kind of idea. Rehab equals training, training equals rehab. And the reason why someone like Charlie would make that type of statement, not to put words in his mouth, is basically that if you train well, if you move well, if you create the right alignment, the right structure, and the right set of sequencing and integration from the brain down into the body parts that are being utilized in that movement pattern, you should be able to get proper recruitment, increased nourishment, blood flow, circulation, nervous system activation, signaling, both afferent and efferent, to and from the muscles that are required for the movement pattern. So as a result, you're going to get relative joint centricity, you're going to have relatively good dynamic posture, you're going to have relative distribution of usage and integration of muscle due to appropriate proprioception inside the body. So if all those things are happening because you're doing the movement well, then obviously the likelihood of injury, A, is low, but B, beyond that, the brain's perception of where the joint is and whether or not it should signal pain or whether or not tissues are being torn or worn down will alter over time. And that altering will then change the body's reaction to movement, and often will lead to less overuse and to actually pain-free movement pattern, which is important. So when the brain recognizes that it's in a good situation, it will permit movement. When the brain recognizes that the joints are aligned and stacked and the load is being distributed appropriately and that the tissue can receive that load in a safe way, it'll let you do more. So that's sort of the idea of progressive overload, but at the same time, you have to do so safely. So I pulled this slide actually from Kevin Hendry and the Rad Roller team and a certification that's related to a foam rolling device that's very uniquely designed with a gap in the middle to protect the spine. But more importantly, what I really like about this is that the concept in terms of ground reaction force and support is that we are a kinetic chain, right? And beyond some of the I would say nuances built inside of this slide, one of the things to recognize really importantly is that the center of gravity will always try and align itself over the base of support. So for example, if the hips were to tilt backwards in this particular slide, so if the hips were to tilt up and back, so the back end of that box is to tip upwards, then that would shift the center of gravity backwards. So as a result of that, then the thorax or the head are going to shift forward. And it usually works up the kinetic chain, like it's kind of that rob from Peter to pay Paul, or rob from Paul to pay Peter, whichever way that goes. But you get the idea. Point is, if one segment has a relative change in order to be, and load change, the other segment up the kinetic chain will start to deal with it. And segments are either going to work from a mobility perspective or a stability perspective, or they're going to move to become more of one or the other based on the requirements and demands that are being placed on the system due to its position at this moment. So every exercise, whether it's static posture like this or any overuse patterns that we have in daily life, sitting at a desk, for example, which a lot of us have done, gaming, which a lot of us have done, runners that go out and go out for a walk for a long time. A lot of my clients, for example, go for daily walks. Well, there's a pattern of overuse attached to that, and therefore some muscles are going to be very much overworked relative to the other. Okay, so continuing forward from that concept, one of the things to bear in mind is this idea of motor control. So hopefully these slides are changing for you guys. Again, what I can't see, 1 second, top chat. I do see a chat over on, give me 1 second. I'm going to check something really quick. I don't see the slides moving on my YouTube channel, but I could be wrong. They probably are moving. The slide I have up there right now is motor control evidence. So I actually took this slide directly from, so Diane, please don't hate me, but I took a seminar from Diane Lee last May, I believe to be correct, on the pelvis and thorax and how certain movement patterns and the biomechanics associated with those things will then alter how people can experience something like a squat or lunge or basic movement patterns, and how that altering of biomechanics or motor control, ability to be able to control the mechanics in the motion, will then have an impact on pain, say, for example, or overuse injuries. So that's why it says talking Diane Lee up in the top corner, because this is a straight up screenshot. The link to that seminar to be able to purchase the course, which I saw one portion of this, there's actually a second portion of it. So you can get both for $100, which is an amazing deal. The amount of information in the 1 4-hour seminar I took was amazing. So anyway, the definition of motor control in essence, in a very simple way, is that all sensory and motor elements related to motor actions, including posture and movement. So, and guys, if for some reason, if my slides aren't moving, because I'm watching myself on YouTube right now and it doesn't appear to be shifting. If that's the case, don't worry, we're going to be coming off these slides momentarily to do practical stuff anyway. So all sensory and motor elements related to motor actions, including posture and movement. So that means we're getting inputs from our external environment, we're getting inputs from our internal environment, and then we're getting commands moving to and from those inputs back and forth the brain. And the result is movement. And the result is posture to keep my center of gravity inside my base of support to be able to accept load. And sometimes it's done well and sometimes it's done not so well. The next slide in this breakdown basically just talks about motor control and pain. So, I mean, there's a lot of evidence around this type of stuff. the one thing I want from this slide, and if you guys send me your email address, I'll be more than happy to pass along these slides to you as it stands. So the most important element for me in this particular slide is that no one person's the same way. The strategy that one person will use may not be the ideal strategy for another person because they have a slightly different anatomy, right? Just like as Janice Burley, who I had hosted last Friday on the Personal Trainer Network, said, just like noses, they're all different on every person. So everyone's pelvis is going to be slightly different. And we've looked at stuff that refers to the femoral head and the shape of the femur inside of the acetabulum, and this, how that will impact squat mechanics, say, for example. So we know that everyone's pattern is different. The thing that I want you to gather from today is that when you assess a pattern in a specific way, not everyone's going to fall into the outcome that you're looking for. However, if you continue to shift, you should be able to find. So we're going to use the squat as an example of this today. Like, I'm going to move the squat around, and we're going to find the right squat for the person. Now, I know Stu McGill has done a bit of work on this in terms of like just the relative position of the femur inside of the acetabulum, and how that will impact the shifting pattern, which looks like this, where you just shift forward and backwards using a wide or narrow stance. And I'll just tell you about your sacrum relative to the femur and femoral head. So I can clearly see that the slides are not moving here. So what I'm going to do, I'm going to come off the slide share just so you guys can see me, and we'll focus more on that part very momentarily. I don't know why the slides aren't moving, but clearly not happening. So they're moving for me nicely. Anyway, we got altered motor control. 1 second here. Let's stop the share. Let's start this. No point going any further down this pathway. It's not working. We'll do it this way. We'll start that share again. Try this in a different manner. I think it'll work like this. Okay, we'll go after this way. Now, hopefully I will see a change on my YouTube channel. Anyway, so there we go. Look at that. At least I think it's moving now. So if we start to look at it from this perspective, we can still gather the basic concept here, which is going to be altered motor control and redistribution of activity within muscles. Okay, so excellent. So altered, that muscular activity is not always correlated consistently to pain. So just because someone arches their lower back, say, for example, when they do a squat, or if they go into a posterior pelvic tilt at the bottom of a squat, say, for example, it doesn't always mean there's going to be pain, because there might be something about that person's architecture that allows that motion to occur in a safe and effective way. Maybe the fascia and the ligaments attachments are allowing movement to occur, and it's not going to cause pain. Oftentimes, these biomechanics, they'll give us a good indicator of what might be problematic going forward. So always bear that in mind. And just because it's pain-free doesn't mean it's going to stay pain-free. It's another important piece to take away from this. So, and at the end of the day, again, the idea is that everything you do, if it's done well, will move you one step further towards pain-free movement, increased mobility, increased neural drive, increased strength and hypertrophy, versus decreased capacity, decreased functionality, and breakdown and tearing, right? So some form of necrosis, if you like. So the goal is to gain, not lose. And as long as you're gaining slightly, even if you're in a pain state at this time, as long as you're gaining slightly, that's good. If you're losing slightly, if you have pain in your knee and it continues to get a little bit worse, because remember, by the time we feel pain, you've had altered biomechanics and you've had altered postural stability and altered control for a long period of time. And it's just now starting to show up because the brain is basically sending the signal to say, whoa, we're at risk of injury, serious long-term chronic degradation of the structures that are required for you to move and move well. So on that note, we're going to continue to move forward down these slides. I don't know why now the slides aren't clicking through, but it is what it is. So we'll try it this way. So if we start looking at bits and pieces of these patterns, like we can look at what optimal range of motion is in the thorax. Like, again, the thing is to realize it's complex and yet it's simple. And from a training perspective, although you can get very fine detailed about making sure every thoracic ring is in its right location, one of the things I find most useful is to watch the mechanics of motion and watch for any altered posture during motion that you're not expecting. Looking for altered motion one side, so your knee is lined up perfectly when you're squatting. You're in a squat position and your knee is perfectly aligned on the one side, but when you go to the other side, that knee drops in. Those type of things are problematic. So we start looking at it from that perspective. There's a lot of different pieces to this puzzle. Okay, so then we could take exercises. So you can go, okay, well, we got an exercise, and great exercises are only great if they're done well. It's as simple as that. It's that simple, and it's that difficult, if that makes any sense to you. So this one exercise, for example, which is an example of a quadruped, or in this case, a 3-point thoracic rotation, has a lot of possible benefits if it's done well. So if it's done well, this will have the lumbar relatively fixated, and then the thorax will be able to move independently of that lumbar. Or the lumbar may move a little bit because it's supposed to, but then the thorax gain most of the range of motion. But the lumbar not be the driver in the motion pattern. The other thing to watch out for is that, okay, well, are we letting the head move? Are we letting the thorax move on the head? Are we letting the head move with the thorax? What's going on with that base shoulder? So the hand that's down on the ground, are we using it in its most purposeful way? Are we using ground reaction forces to allow our core to fire? And then are we integrating breath pattern over top of that in such a way that generates better movement, more alignment, more structure, more opportunity for the body to actually work? And the reality is, more times than not, those nuances aren't taken care of. And because the nuances aren't really focused on, and I find that to be even more of a challenge in today's world, which is, I would say, the virtual world, it's a lot more challenging. The result of not locking down on the nuances in a pattern like this one, which is a great exercise, is that the good exercise actually leads to further motor control problems. So I'm going to give you a bit of a live demo of this. So I'm just going to come off screen share, so I can be full screen and I can actually see what I'm doing on my big screen, because I'm a tiny little screen on this. So now if I look at that pattern, say for example, okay, so we take that exact pattern, which is a good possible exercise, and the person that's on that screen actually looks quite good at doing the exercise. I'm not going to do the assisted version of that where the band helps pull me into rotation. I could, because I have a band over here right now. So if I was to get into this pattern, okay, there's a lot of things that can go right, but more times than not, we take a great exercise, and because we don't add or up level the exercise into its appropriate head to toe stability patterns, the appropriate breath patterns, the appropriate alignment and structure, then the result is actually more damage than good. So instead of moving the prepare function in parallel with the perform function, we're actually moving in the wrong direction. So we might end up with more pain versus less, which is ridiculous. So more restriction of range of motion versus more gain in range of motion. So if we take that pattern, I'm going to show it to you from two perspectives, okay? So step one, are my knees below my hips or slightly wider? Are my hands below my shoulders? And do I have equal distribution of my weight between my knees and my shoulders and hands? Okay, that's one. And then from two, now what am I doing with all this? Now, am I relatively neutral to start the thing? So if I'm not, so here I am, boom, I'm set up, but I am in a lordotic posture. So if I'm in a lordotic posture, I'm already telling the lower back muscles to do work, and therefore I'm going to de-recruit muscles up and down the kinetic chain from there. So my glutes are now sort of de-recruited, my thoracic muscles and some of my intrinsic muscles around my spine are de-recruited, some are turned on, some are turned off. So now step one, get into that neutral spine. Step two, are my shoulders up into my earlobes because I've got a head forward posture, I've been sitting at a desk all day. So I'm going to draw the shoulders down away from the ears. I'm going to try and realign my posture to get as much alignment as I can. Now is my head down here? Is my head up? Do I have that stack? If we go back to that skeleton at the beginning, do I have that position where my head is long, my neck is long, I'm in this position. I've got my weight equally distributed. Got my toes tucked under so I can actually push my big toes, the bottom of my fifth metatarsal, into the floor. And now from that position, can I be perfectly stable and pick my hand up? Or did I dump in my shoulder? Did I shift out of my hips? And if any of those things are happening, it's going to change. It's going to alter the biomechanics of the pattern. So if I'm not set up properly, and I don't have that intrinsic feedback that I have right now being on screen, etc., what's going to happen then is that I'm going to start doing this exercise. I'm going to start driving over an unstable shoulder. I'm going to start driving over an unstable pelvis. So the gains that could possibly come out of this are minimal, and I'll probably never ever fully gain range of motion in a thorax. And whatever range of motion I gain might be coming from things up and down the kinetic chain. Whatever stability that's required in that proximal stability pattern to drive mobility is lost. So the result is not an exercise that could have been fantastic, but 99 times out of 100 is missing one of the key elements to have proximal stability drive distal mobility and strength. Okay, so bear that in mind. So great things are only great if they're done well. And that's really that simple. I hate to say that, but that's just the reality of the situation. So now, luckily for me, so I'm not dealing with these cold notes, I got a few more exercises. So, and I'm not saying I'm perfect at these exercises, and I'm not saying you should be perfect at any of the movement patterns I'm about to do. What I'm saying is that there are foundations required in every movement. And then once you nail these foundations and we get this relative structure inside of our body using basic foundational movement patterns, understanding that we want mobility out of the ankle, mobility out of the hip, mobility out of the thorax, we want stability in the lumbopelvic hip complex, we want stability in the knees, right? We want stability in a portion of my cervical spine, for example, especially in that suboccipital level, right? So all those things will dictate what happens when I then try and transfer to life and reacting in life and sport and reacting in sport, because then I have a lot of vector variability and my body needs to have the structural integrity to support me, even if it doesn't have the experience of doing those movement patterns. And then the more specific my requirement or demands are in life and sport, the more I would want to load those specific patterns. And we can start getting into some of the nuances associated with specificity. And one of the best that I've seen in this particular topic area, and someone who's worked with a lot of Olympians specifically on this, is Scott Livingston. So it's a colleague and friend of mine, someone I've known for a long time. So if you're interested in how to take basic rehab exercises and turn them into your workout, and then turn your workout into specific demands in association with the clients that are in front of you, that might require, the requirements might be something that's in a work situation to help them safely and effectively get through the workday without progressive overload of tissue, and to get into problems associated with pattern overload there, and secondarily to get into a sport where someone's going to be overloading a pattern a lot. And if we haven't prepared that pattern well, or it has an instability or an immobility on the joints that are required in a heavy way, they're going to cause a lot of significant demand challenges, and those demand challenges usually lead to acute and chronic injuries, which absolutely is devastating to an athlete. Lost training time is one of the #1 indicators of lost performance in sports. So certainly not something you want to deal with. Anyway, so that being said, so we can take some basic patterns. So one of the things I like to think about is like, well, getting from the assessment all the way up to high demand and high function. So starting at relatively low function requirements and foundations, and then moving all the way up to specificity and high performance sport. How can I make things challenging and set people up for success, because I'm using some intrinsic combination of mobility and stability? So if I take this first pattern, say for example, which is down dog, okay, so I'm not saying I'm a down dog expert. In fact, if you're paying attention, you will see that I'm not perfect in this. Now, if I'm too far away, like if I have a lot of kyphosis in my upper back, if I can't get my knees straight, then I need a regression. I need a way to make this a little bit easier on me. And there's always a way. You just have to think your way through it, because if posture is distorted in the movement pattern, if I'm going to then try and progress that to add load and add vector variability and add demands, I'm in trouble. Now, if it's just down dog and it's unloaded, and I'm not perfect, but I'm inching my way towards a better version of that down dog, it's okay. That's where yoga and body weight movement prep exercises can be beneficial without perfection, because you're continuing to try and engage the right segmental control. You're trying to engage the right mobility at the right joint in the right way in order to be able to then transition it into loaded pattern. So take it down dog. Okay, again, not something I'm very good at, to be perfectly honest. Now, obviously, some of the requirements could be soft tissue releasing, things like the hamstrings, the calves, the bottom of the feet, getting into the plantar fascia all the way up into the thorax, middle back, etc. And I could do all those things. And I'm not saying you shouldn't do it, but if we're just talking about managing the movement pattern, we'll take something as dead simple as, okay, well, I've got my client working out. I've got my client doing this thing probably on TV at this point in time for many of us. Hopefully that'll change very soon. I hope for that to be the case. And then I get into this position. Okay, so I get here and I got to start thinking about those foundations again. So am I engaged in my upper body? Right? Are my toes tucked down and ready to be able to ground into the earth to give me some kind of ground reaction, give me some feedback, to get my feet and ankles mobilizing the way I want this exercise to get? Because this exercise has all kinds of benefit if done well, and it does have very little benefit other than me hinging off some of my joints if I'm not doing it well. So I'm going to create compression. I'm going to corkscrew my hand into the ground to get tension up in my upper back. I'm going to use my breath here momentarily too. I got my toes tucked under. I've got equal distribution of weight between my knees and my feet. And then I'm going to walk in and push up and back. Now, when I push, I'm really earthed and I'm pushing. I'm creating tension in my upper body. I'm going to pull my shoulders away from my earlobes. I'm going to try and drop my chest towards the floor as much as I possibly can. I'm looking for as much a neutral alignment as I can. My earlobes in line with my arms. If I can't get there, that's okay today, okay? But I'm trying to get my earlobes in line with my arms and my biceps. I'm trying to lock my shoulders down. I'm trying to get my feet straight ahead, so I'm going to screw my foot into the ground. In this case, I'm going to screw that right foot out because it wants to turn. And then I'm going to just start to walk my feet, holding this tension in my hands. So I've still got tension in my hands. I've still got some compression in my middle upper back. I'm holding that tension. And this exercise for me right now is work, because I've got tension here. I've got tension down here, drawing my shoulders away from my ears, using some of the small muscles that are my lower traps, etc. I've got my abdominals engaged slightly. I'm now starting to put tension down through my quadriceps to try and get my hamstrings to relax. So I'm actually intentionally firing my quads to try and that terminal knee extension. And then I'm going to start to slowly pull my toes towards my shins so I can actually get my calves to relax. So I'm actually thinking about dorsiflexing while I'm in that pattern. So I can just get up there and go bam. 10, 9, 8, 7. Oh yeah, my right foot's turned out a little bit, or I can do something about it. I can start engaging. I can start tightening. As soon as I fire my quads, my heels pushed into the floor. And because I've got firing pattern around those joints, and then when I do one thing, did I manage the other stuff? So I focus on my quads and lose my upper back. So that's what movement management's all about. And those are the kind of things that you need to be aware of. You ask for one, you may get it, but at the expense of something previously asked for. So again, be very careful about how much information you ask for. Try and get the person in front of you to give you one thing. And maybe it's the one thing that's the most obvious checkpoint. So for me, it would be my thorax. So it would definitely be earthing into the floor with my hands, draw my shoulders away from my ears, getting my head alignment, getting that alignment of my arms in terms of my head and biceps, etc. But managing tension. Once I have that, then I can be like, hey, look, now we got that. Let's go and grab your quads, because you're telling me that your hamstrings are tight. I can help reduce that tightness, but part of that is to get your quads to fire in this position, get that terminal knee extension, and that'll take some of the tension off the hamstring, but also deepen you into this pattern in a safe and effective way, because you're actually getting some force closure. So pulling up on the toes, pushing down with the quads, I'm getting stability in those joints so that my nervous system goes, okay, you know what? Whoa, there's a little tension there for sure, but I'm safe because I've created that relative stacking of the joints and that relative centricity of the joint. So information up and down the chain. So that's one exercise, for example, that's dead simple to do and really difficult to do well. One of my all-time favorites when it comes to this thing is called the Jane Fonda. Again, one of those things that if you do it in the Jane Fonda fashion, and I mean, no disrespect, Jane, you're an amazing human being, you changed this industry forever, but a lot of people, when they were doing these videos back in the day, just didn't understand anything but isolating the adductors, and probably didn't even understand how to do that well, to be perfectly honest. But now we're going to take Jane Fonda, which is you're going to see just how difficult this exercise is. I'm going to show you from the side, and then I'm going to show you from the front. Okay, so Jane Fonda is this. It looks like a Jane Fonda. Okay, so look, top leg bent up and over, tucked in against my thigh wherever I want it to be, relative straight line from my earlobe down to my ankle. And I mean relative because it's not really straight, but I'm going to get into the details. This bottom shoulder, not stable. I'm into a full shrug position right now because that's just what my body wants to do. My thorax is into a lateral flexion because it's dropping down. And then, boom, here we go, right? 8, 9, 10, 11, 12, 18, 800, 900, whatever. It doesn't matter how many repetitions. It's pointless. Yes, I may get something out of my inner thigh, but I'm not engaging the entire kinetic chain. I'm not creating mobility around stability, which is a much better usage as we add load or add vector variability and demand. So at the end of the day, we're not going to get injured when we're flopping around the floor like this. We're going to get injured when we now try and transition this adductor strength into a lateral squat, or if we transition that into skating, or if we transition into stop and go sports, et cetera, et cetera. Not that anyone would think Jane Fonda was going to set them up. But now here's both an assessment. So the assessment for me is lie down, arms straight, best I can. If it needs to be bent, it's bent. Put my head on my arm, get a straight line from earlobe down to bottom ankle. Dorsiflex, so I'm absolutely flat-footed. Knee absolutely straight, even though I'll let people do the first rep to see if it actually unstraightens, meaning the knee will bend like this. Okay, so if that's the case, and then all I do is I lift that heel straight up. It's got to go straight up. I'll usually use a pole to stop it, and I measure the height of the ankle off the floor. Now, that's just a relative sort of lateral line, particularly in the lower quadrant assessment of that relative tissue length capacity through activation of the inner thigh. Now, to train it, I want it to have transfer. So that means I want my upper body involved. I want my lower body involved. I want my pelvis relatively stable in that position. So I come up and then I start doing a whole bunch of different things. Okay. So I reach my hand through, and I'm going to tell you right now, you want to talk about a hard exercise that can be done really poorly, dropping the shoulders, not creating tension, etc. Versus, so this is me getting my foot off the ground right now with a bunch of compensations, not working too hard. This is me now engaging my bottom shoulder to get a nice long line. I'm going to get my head in the right position so it's neutral relative to my spine. Bring it back so it's long through the neck. I'm going to engage hard through my abductors of my shoulders, so I'm actually forcefully pushing into the ground right now. And then I'm going to grab onto this ankle. I'm going to use my breath with a big force inhalation. Okay, so get my head in neutral, big force inhalation. Try and diaphragmatic breathe it, and then I'm going to exhale to lift. When I run out of breath, I'm going to put my leg back down. So inhale, exhale. If you do this well, your shoulders are going to be sore, your top oblique is going to be sore, your adductors are going to fire right up into your pelvic floor and your levator ani. So, and that, for example, can really help people that have hip pain or a femoral head that is slightly abducted, because we want to pull that thing back in. So if you, there are lots, okay, backtrack a sec. If you're having hip pain and that assessment pattern is relatively low, you don't have much tissue length capacity in that bottom foot relative on that lateral line, then if you don't have 12 inches of lift off the ground, between 9 and 12 inches of heel straight lift off the ground, you're going to want to work on the Jane Fonda, and you're going to want to do it in a very purposeful way, because it will definitely have an impact of where that femoral head sits inside the acetabulum, and therefore is going to impact your squat mechanics, your sprint mechanics, your lunge mechanics, and any other convoluted exercise, leg press, etc., that you can do in the gym. So that said, that's why we do these foundational patterns. We take another one, okay? So another great exercise. So one of the examples of an assessment is what's called the straight leg raise. It's used orthopedically, it's used in rehab, it's used through the FMS system, etc. There's a zillion different ways to actually bring this information into play. So I'm going to do one more of these, and then I'm going to transfer over to stuff that's a little bit more high function. Again, talking about the importance of breath, talking about the importance of setup, talking about the importance of creating the right demand in the right place at the right time. So if we take the straight leg raise assessment, for example, which I'll do it from the side. Okay, so I'm lying on my back. I got my back flat. I'm going to cross my arms over because I don't want any assistance into my core here. Not right now. I can use it for training purposes. But I like, again, training. The workout is the corrective, okay? So the workout is your rehab in the sense that if you do it well, these exercises will cause you to have a sweat. So the next one, okay? So very simple. Feet are hip width apart. Toes are pointing towards the ceiling. Knees are absolutely straight. Arms are crossed. Back is relatively flat. Okay, so you don't have to you're not arching your back. You don't have to force it into the floor completely. And then from this position, just holding that sort of natural posture, I'm going to pay attention. Is there a lot of space in the lower back? So before anything else happens, is this person naturally lordotic? Now, could they have a slightly bigger caboose? Sure, absolutely. So then if they've got really well set of glutes, their back might not be completely flat in this particular pattern, but it also won't be curved necessarily if it has good posture. Now, so from here, is there an excessive neck curve? Is there excessive lower back curve? So first thing I can notice is posture, okay? Are the shoulders off the ground or are they on the ground, laying flat? The scapula appear to be flat on the floor. All information I can gain before they've even moved one iota. So from this piece of information, the next piece, okay, is one foot turned out and the other one pointing straight up, okay? Or both feet pointing straight up like they should naturally want to do. Slight turnout's fine. Excessive turnouts, again, could be architecture, but more times than not, it's a bit of an issue, okay? So feet are straight. Now I'm going to do the assessment. From this, I'm going to do is have someone, without doing any additional work, lift their leg up. So I'm not going to give them any aggressive core bracing cues or any of that nature. I'm just going to say, okay, legs straight, toes pointing straight up. Lift your leg off the ground. And then I'm going to see if the pelvis rotates. So when I lift the leg, I lift my left one, it's all good. My right one, I can feel my right hip turn. So I can feel this tilt, right? So I'm looking to see if I lift one, if the opposite hip tilts up in that pattern. So if I see that tilting pattern, I know they do not have complete lumbopelvic hip complex stability, specifically as it relates to muscles that are running down the front half of the body. Not to say that some of the back half's not influenced or involved. Now, so I've got that information. Now, the exercise or the workout becomes the rehab. So I know I've got an issue, but now I've got to create relative consistent demand one side versus the other. Again, no one's exact as the same. So if I try something I believe is going to work, but it doesn't ever work, meaning it doesn't change the outcome, I've either got the wrong driver, I've chosen the wrong exercise, the architecture of that particular individual isn't such that this exercise is going to work for them, etc. But the point is, don't keep beating a dead horse. It either works or it doesn't work, particularly if you've set it up reasonably well. So now I take the band. I'm going to move a little further away. I might slightly go off screen on this, but I think I'm okay. Okay, so I'll choke up on this a little bit, but now I'm going to see the second piece of this puzzle. Arms across. I'm going to ask them to lift their leg up as far as it can go absolutely straight. Bottom leg straight, top leg straight. Watch your range of motion. Ideal somewhere between 90 and about 100 degrees. Set it up, check the other side. I'm going to see if there's any asymmetries one side versus the other. If one knee wants to bend, if one foot wants to turn out. It's usually sometimes related to, particularly if I did that leg lift and that side was unstable versus the other side, then I might think that stability is one of the drivers. Now to confirm that, I add stability. So I take a band, I add stability. I'm going to tighten the core. So intentionally going to core brace. I'm going to use my breath again. Inhale. I'm going to exhale full. So I'm going to inhale the setup. Get everything flat and tight. Increase diaphragmatic activation. And I'm going to exhale. Pull knee to chest. Back absolutely flat. Other leg absolutely straight. It's also getting some information about the hip flexors, by the way, so because we're using a reciprocal flexion extension pattern. And then I'm going to kick up as best I possibly can. Now, if all of a sudden I'm magically better, Okay, so if I do a straight leg raise now, and I'm magically better than I was previously, particularly if it was also associated with an unstable 6-inch straight leg raise, I know that stability and creating stability in the core was one of the drivers. So if I could increase my stability, so then I'm going to continue to work on combinations of core stability, which could start all from low threshold and move all the way up to high threshold patterning. Okay, so where there's low load or high load. So that straight leg raise exercise, again, same thing. It's really easy to do. I pull a band, boom. So I grab a band, I pull. I lift my leg, bam, okay? Knee is bent, foot's corkscrewed out to the outside, back arch as I pull this up. I get nothing out of this whatsoever. My neck, I'm like almost doing a neck bridge like a pro wrestler. There's no value in that, okay? So tuck the chin, drag the shoulders down, pull, flatten the shoulder blades onto the ground, bring your ribs towards your pelvis to get the back relatively flat to the floor to get really positive core engagement. Then tuck the knee straight in, making sure it's coming straight, not in a cockeyed pattern. Whatever you get, and then keeping the other knee VMO fired, so quads are on tight right now. Toes pulled, so the dorsiflexors are firing. And then kick, 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 making sure the foot goes up straight. And all of a sudden, if I start feeling that in the right places, okay, stretching the hamstring, stretching the calves, quads firing, not my hip, I've got all the information I need. This has become a great exercise where the workout equals the rehab, right? And it's meant to be hard. So like it's highly engaged. It's head to toe, right? Cervical neck flexors are involved. Shoulder depressors are involved. Abdominals are involved. Quadriceps are involved. Tibialis anterior and the dorsiflexors are involved. Like it's head to toe. My shoulders are involved in a pullover pattern. And it's not that all things had to be high threshold, but if I'm prepping for a workout or if I'm prepping for high function activities like a sport, then some of my corrective exercises are going to have to be high threshold. You sometimes have to back the bus up, but if you're really backing the bus up into low threshold activities, I highly recommend you pass them off to a therapist who are very good at palpation, who are very good at using breath and integration, who are very good at slowly and patiently working that client or patient towards better relative stability and mobility. Now, I say that for a reason. I'm going to say it, be very loud and clear about this. Don't try and be all things to all people. Okay, if you're a trainer, behave in a trainer kind of way, which means that the goals associated with the client are to help them move safely and effectively towards an end goal that has some kind of performance or capacity element to it. Now, is there a zillion paths along that continuum from high function to low function to high function? Of course there is. The issue being is that if you behave in a passive turn on, okay, here we go. We're going to draw the belly button towards your spine. I want you to turn on those muscles at about 40% of your maximum. I want you to take a nice, slow, easy breath. I want you to exhale, and on the exhale, I want you to turn on your stop P muscles because we want to get relative lumbopelvic complex stability and maybe turn on your multifidus while accessing a portion of your transverse abdominis, et cetera, and and then I want to feel a slight palpation into your inguinal ligament while we're doing that. And the client came there to lose 15 pounds. So the client showed up to lose 15 pounds, and you're like woo-sawing them to sleep. Deep breath, meditate, find your chi, feel your femoral head centralizing inside of your acetabulum. Feel how your body is now centered and ready to move, and now go. I mean, that's a difficult conversation. So know where your line in the sand is, and if you're having trouble, if one of these higher threshold type activities doesn't get the outcome you're looking for, if there's extreme pain that's been chronic in nature and you can't somehow make a relatively quick change to it, that's when therapy is required, and let people do what they do at a very high level and do a great job of it. Okay, so that being said, another one of my favorite exercises is the pull-off press. Now, again, this could be a training exercise or it could be a relatively well done stability exercise. The reason why I know a lot of the issues that come along with some of these patterns, for example, is that I made all the mistakes. Okay, I've done them all. I've made every mistake you could possibly imagine. So if we take a pull-off press, for example, my setup is as follows. Okay, and there's variations of this I love doing, and we're going to do some of those momentarily. I will change the orientation of this pattern. I will take a fixed point, anywhere from low to about medium in height, relatively speaking. I'm going to get into the 1990 position, which means I'm going to be hip width apart. My back foot is going to be fully big toe engaged into the floor. So I got some extension pattern under my toes. Okay. So, flexion pattern, sorry. And then from this, or extension. All right. So then I'm going to get myself lined up. Okay. So once I'm lined up, I'm going to lean forward ever so slightly to get a little bit of hip extension. Not that I need to, but a lot of people are stuck in the sitting disease. They're going to come at this, and I'm going to just turn this sideways a little bit. Okay, they're going to come at this pattern like this, and when they're there, they're going to be back arched. They're going to extend this way, so they're going to arch the lower back. They're not going to keep their abdominals engaged, relatively speaking. This is obviously an abdominal loaded exercise, so if that's the case, there's nothing good going to come out of that. I'm going to tell my glutes to turn off by putting my foot down flat. I want that big toe pushed and earthed into the ground, driving my hip forward, but driving my hip forward as a unit. So I come forward as one. And if I'm going to try and help this beyond the core activation, so if I just want straight core activation, I will do this perfectly sideways. If I'm really starting, I can start varying vectors, all kinds of different things you can do. So now, let's see basic setup. 1990 position, head down to knee, one straight line, earlobe, splitting that kneecap right in half. Good idea. Okay, so from that in that position, I've got my setup, and then in my next piece, shoulders down, ribs towards pelvis, abs are engaged, back glutes fired, and then I'm just going to press straight with my inhale. So I'm going to inhale, fill up the diaphragm, get those fill up my lungs, get my diaphragm to activate, get that deep integrated segmental control in the abdominals, and then I'm going to exhale. And when I exhale, I'm going to brace my core. So I'm going to core brace. I'm going to create some tension inside my body, press straight out. When I press straight out, I'm going to look at the scapula in the back of my shoulders. Like I'm going to take a look. So that's why when I'm working with clients, like I'll get them to show me this pattern facing away and forwards and sideways. Every set's an opportunity to get more information. So change the vantage point during the training session all the way through and keep your eyes on the prize the whole way. So now, so we got this great exercise. Okay, so again, more times than not, I see people go in here and they're doing the pattern from a hip flex position. Okay, so that's called a jiggle bump. Nothing good going on there. Okay, and any chance you get a chance to slap your own ass on a Friday, you do it. Just to be clear. Now push through, but when you push through, did I alter the biomechanics? Did I drive hip extension also with back extension? Right, and that could have purpose somewhere along the way, but that's not the goal. I want this to be relatively neutral, then come forward, get some length out of the front of my thigh, particularly knowing that that may be an issue, or maybe I've assessed it with a Thomas test or a modified Thomas test or line. I'm going to bring the head now forward. Right, now I've lost my ability to make my shoulders do its job properly. So bring the head back, get the relative alignment in the position, and then follow with your pull-up press. So all these patterns, now you got to add the breath in. So, okay, you got one, you got two, excellent. Your hips are in a good position, your shoulders are in a good position, your abdominals are fired. Now that we've got this figured out, and this might be like 3 workouts later, let's focus on the breath now. So, inhale. Fill up your abdomen. Feel pressure running from the front of your back to from your abdominals all the way around the side of your side walls of your abdominal cavity and then into your lower back. That you can work on from the floor, say for example, as part of your warm-up as well. Once you have that, now we're going to breathe out, we're going to exhale, and we're going to keep exhaling. And we're going to use a force exhalation, because one of the things we're trying to do is we're trying to wake up and activate for a workout. I'm trying to enhance sympathetic nervous system dominance right now, not parasympathetic nervous system dominance. I don't want my body relaxing. I'm trying to drive force and tension segmentally from head to toe that I'm going to now utilize in my workout to make sure my workout is safe and effective, that my workout now sets my body up to be more pain-free, to be more resilient, to be more robust, and able to use these mobility stability gains in vector variable ways. So that makes sense? So the pull-off press, another great exercise, often done poorly. Now, how do I add challenge, say for example? So how do I make that exercise become a workout. So now I can turn this into a pec exercise. It's already a pec exercise. It's already a posterior deltoid exercise. But if I do the exact same thing, I've got everything nailed. Inhale, exhale. I can release my outside hand. Now I've got to hold this shoulder stability, hold this core contraction. My pecs are working for dear life. And then I can add spinal rotation. And at the end of the spinal rotation, I can add wrist extension. Get as much wrist extension as I can to get people out of the computer generation. So I can all of a sudden turn this exercise into great. Now that's one variation. Another variation is I've released the outs. I hold with the outside hand, release the inside hand, and work on thoracic rotation in the opposite direction. The reason why I like to go this way with this is because I've got a fixed lumbar support. So this is relatively fixed. And then all the motion over top of it on that same side in that same direction. So if the right hip is forward, rotating backwards to the right will be mostly that lumbar portion of my spine is relatively fixed forward. Therefore, most of the motion I'm getting is coming out of my thorax. And in many cases, thoracic mobility is poorly executed as a result of kyphotic postures, etc. Again, I could do lots of demos in this kind of stuff, but it's not really the point of today's seminar. Last but not least, so we're going to squat. Okay, so let's take the squat pattern. This will be the last thing I cover off today. Oh my God, time flies fast. I believe, okay, I've gone through let me put it this way. I've gone through places in my life where I thought no one should squat because I could never figure out how to squat pain-free. As a result of overuse of my lower back muscles, basically everything I did in a lordotic posture, heavy deadlifts, heavy squats, to create tension around the lower back to give spinal support, because I didn't know any other way to get spinal support. I didn't know I could use my abs. I didn't know I could use my breath. I didn't know I could use my feet. I didn't know I could bend the bar to get tension in my lats. Like, I didn't know I could do any of these things to create body tension, to create spinal segmental control. No clue, okay? So, easiest way for me to get control of my back was to go, wham, let's squat. And I did it. And I did it pretty successfully. I got really flipping strong. Eventually, you tell the lower back muscle to work under heavy load long enough, and you tell your abs to relax and be distended, they're eventually going to get weak. Tight, weak, tight. Okay? That's very much a lower cross syndrome. I had it. I couldn't walk the length of a beach without being like in pain. I couldn't squat without pain. On top of that, I was a rotational sport athlete. So guess what? I, in the shower, looked down at myself, I'm like, why is my right hip rotated forward at all times? It's an issue. So I never did do a proper squat. The result of that is my knee falling inwards. I've also sprained my right ankle, so I had poor ankle mobility. So squatting as an exercise could fix and help fix my core instability and muscle imbalances. It could help mobilize my ankle without structural issues that are in there, obviously, or it can continue to feed this, which is this. So my right hip comes forward, that knee comes with it, okay? I can feed this, which weakens my glutes. So my glutes can't do anything, so therefore my femoral head's going to shoot forward, and the hip flexors are going to be firing the whole way down, deep and strong, okay? So I can either get relative tension in the body and great proprioception because all the joint is centered. I could get good, clean mobility gains, or I could continue to gain in one place, lose in another place, create overuse in one set of tissues and underuse in another set of tissues. And the result being a great exercise for metabolic demand, transfer to a whole host of sports, sprinting, jumping, you name it kind of idea, and just basic leg development. Out the door because I'm in pain all the time. Or I could do this. I could recognize that we're all individually built, therefore I'm going to squat differently based on that. Some people have to squat with their feet out, and it's very simple to know if they need to squat with their feet out or not, okay? So the Stu McGill version of this test, and Stu, please don't get upset at me if I don't quite get it right, but the idea is that you've got two variations of this, okay? So your knees are relatively hip width apart, toes are, and you just sit back. And if you sit back and all of a sudden you have a spinal posture change like this, boom, right? Or like this, and you get stuck, then a hip width position for your sacrum is not good in terms of the biomechanics of the sacropemoral joint. Okay, so that issue will then obviously have problems because the femur is not sitting in the right spot now, and it's a relatively unloaded pattern, so it's not postural tensions or issues that are pulling the femur relative to it's a good way to look at, do I have the mechanics? Now, if I stand this up and I start looking at the squat, there's still, okay, getting past this basic mechanical concept, there's still more information to be gathered. What's it like to be a standing human being? Someone who's walking, squatting, lunging, etc. And how do those architectures integrate with the ability of the body to stabilize and mobilize through the tissues that are in support of those particular structures that are required? So, get up, I get a squat. So I get someone into a standard squat position, which in the NASM textbook of assessment, feet pointing straight ahead, shoulder width apart, and then we can do variations of this, hands on the lower back to see where the sacrum's going, hands on the hips to see where the pelvis is going, et cetera, arms overhead, whichever works best for you, really. And I have them squat, okay? So when I have someone squat, when they do so, if they're relatively symmetrical, and I'm not dead in front of the TV, if they're relatively symmetrical, they're going to squat so that their weight stays equal between the base of support. So they're going to have not shift to one side, not shift to the other. The ankle isn't going to pronate in on one side. The knee's not going to go valgus on that side. The back's not going to arch. So we're neutral, and all of a sudden squat, 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 boom, like that. So we're not going to lead like this. We're going to hold that relative position. We're going to squat down, and we're going to hold that neutral spine pattern, and the spine won't change in the bottom as you come out of the hole. A lot of things to manage. On top of that, we still don't know who the driver is, right? So even if we do see all the mechanics, we don't know, did the ankle go, but you saw the knee because the knee was a big move. But in fact, what ended up happening is that the arch of the foot collapsed and the ankle pronated, okay? So the subtalar joint pronated, and the result was, bam, the knee came with it, but the ankle pulled the knee, right? Okay? In the same way, did this lead to this, right? We have to see where the driver is, and it's usually the first thing that happens. And at what point, what range of motion does it happen? Is there a clear range of motion that works and a range of motion that doesn't work? So a basic way to know what squat works best for someone. So the idea of a squat, obviously, is get roughly parallel to the floor, have relatively good biomechanics up and down the kinetic chain, get your thighs relatively parallel to the floor, at least 90-degree angle, the knee, hip, and not have any transitioning changes, to have your torso parallel to your tibia, and then have your weight in the tripod of your foot, not having one foot turned out more than the other, etc. Having weight relatively equally distributed. If that you can't do, for example, in the standard setup, which is feet shoulder width apart, okay, and then squatting down, and you can't achieve that, does that mean you shouldn't squat? It definitely means you shouldn't squat that way, because that means that something is going to compensate up and down that kinetic chain. And the result of that alteration will be chronic and or acute trauma, depending on how much load and how much demand is put on the tissues around it. So a great way to figure out. So you start here. Okay, you know what? Let's try hip width, squat down. Altered biomechanics almost right away. Okay, can't get very deep. Clearly a change in the relative sacrum, pelvis, spinal pattern. Clear changes in the ankle pattern. Can't get there. That's not going to work. Let's turn the feet out. So exact same thing. Let's get the femoral head in a different position, and let's squat down. And all of a sudden they become a magically better squatter. That's the squat. So if it now all of a sudden most of the biomechanical errors are gone, then have someone turn their feet out. This could mean it's a femoral issue relative to the acetabulum, or it could mean that it's an ankle issue because you need relatively less ankle mobility to get your knees beyond your toes versus this position. So if we're here, you don't need as much ankle mobility. So could be ankles, could be architecture problem. Still don't know, doesn't really matter. This is the squat pattern for now. And then with deeper assessment, you can figure out if the ankle's the issue. We can do various forms of assessment. Some of this stuff can be found in FMS. But so I use what's called a kickstand assessment. I line up my back toe in line with the lateral malleolus or the medial malleolus. So my back toe is lined up. And then I squat down with all my weight in the front foot, both feet flat, but my front foot taking all the weight. So at the end of the day, it's this pattern, my front foot, and how far does my knee go past? So can my knee move beyond my toes by a certain amount? On one side, is it different than the other side? And that's sort of like, that's a basic kickstand type approach. And then, so you can also see that back foot actually becomes the load foot. Sorry, my bad. I just did that completely different. I just had a brain cramp. So boom, medial malleolus, big toe. And when I squat down, all the weight in that back foot, making sure that heel does not elevate. Does my knee get to the other shin bone? And is my knee somewhere between 4 and 6 inches past my toe? So that's what I'm actually looking for right here. Is my knee 4 to 6 inches past my toe? Another way to look at it, is my knee in a position where relative to this other shin, is it almost in this, is it as far forward kind of idea? The FMS is a bit structured about coming this, but simple measurement, drop a straight line down, use a ruler. Am I 4 to 6 inches past the toe? And if not, and is it different one side versus the other? If it's not 3, 4, or 5 inches beyond in that squat pattern, with everything lined up, knee tracking directly over second and third toe, not in or out, there's an issue. And if you have that issue, then you're going to want to start working on ankle mobility. And the exercise, the workout, a tripod squat or a kickstand squat becomes the corrective. So we can actually do this exercise. So I go into now up on my big toe. So I'll do it this way. Come up on my big toe and I squat down, trying to get my thighs parallel to one another. So exact same setup as the assessment. I can weight load this in a goblet position, et cetera, et cetera. I'll do it. I got this thing called a Y bell. I'll hold that in the goblet position. I'm going to corkscrew my feet into the ground, create some tension. Okay, so now I've got an arch in my foot that I normally don't have. So I just externally rotate it through the foot, and I create a little bit of an arch. Normally my foot's really flat. That external rotation, creating alignment. I'm going to squat down. My thighs are going to get parallel to the floor, and all of a sudden I'm a magically better squatter. Boom, I could sink down nice and deep. There's no range of motion issue. And if I do it on the other side, exact same thing. Isolate. Now the exercise, if done well, watching for altered biomechanics, becomes the corrective. I can put extra emphasis on the Achilles, ankle mobility, at the same time put some load to the quads, do so in a biomechanically aligned, structured way, and the exercise becomes rehab. So, in summary, this can be done for everything. Every exercise should have structure, every exercise should have setup, every exercise should be difficult, done with just body weight alone, and the load is just one of the intensifiers. Adding extra weights is an intensifier. Adding extra velocity is an intensifier. Adding extra range of motion is an intensifier. Adding complexity of the movement patterns is an intensifier. So start people off with foundations. Teach people how to get engaged, create stability, create mobility over top of that stability from head to toe, starting with foundational patterns on the ground, working it all the way up to standing patterns and getting into your functional, 8, 10 patterns, however you want to go, push, pull, squat, lunge, chop, lift, that type of stuff, right? So I make sure people can do all those things incredibly well, then translate it into all these different variations of exercises. And if you do so in an effective, progressive way, clients will easily and safely achieve the goals of function, movement, health, fitness, and performance in a safe and effective way. Sorry for the glitch at the beginning. I'm not sure why the slides weren't moving. Appreciate you guys being here. Any feedback that's been coming in through the chat channels, I will definitely take a look at over the next 24 hours or so and answer questions. And I will see you guys again really soon. Enjoy your weekend. Peace.